Well, October is Breast Cancer Awareness Month, and today on the show we are at the Regional Cancer Center office of Singing River Health System in Ocean Springs. We're talking to Dr. John Bailey. How are you?
I'm fine. It's good to see you again.
It's good to see you again. We've talked in the past. Today we're going to be talking about things about early detection, risk assessments. But you as a surgeon, what are the things that you deal with, and whether it's pre-surgery, during surgery, post-op?
Very good. So this center also has the imaging center for the hospital for the Ocean Springs market. Mm-hmm. And so when a patient finds a mass or is coming in for routine screening and they find a mass on mammography or ultrasound, then that patient is typically referred to me as a breast surgeon to determine should we do a biopsy, and if so, how to get to that mass and do the biopsy. Many of these we can do with needles nowadays as opposed to having to go to the operating room and go to sleep. The majority we're able to do in the office under ultrasound guidance. And so oftentimes the patient can have their mass discovered, come and see me within a few days, and have the biopsy done the same day, and typically within 24 hours have a result that we can then tell the patient either we need to do more or you're fine and you don't have cancer.
Now, one of the things that we, last month when we visited with Singing River Health System over at Pascagoula, we saw the new 3D system. That is really nice.
It is impressive. It is going to allow us to find even more lesions at an earlier age and hopefully get more cures.
So once they come to you, there are different types of surgeries that you were talking to them about. What are your options? Whether you do simple mastectomy, radical mastectomy, or anything like that.
That is correct. Most women are able to qualify for what we call a lumpectomy based on smaller sized tumors. But we also offer mastectomy. We offer modified radical mastectomy for those that have lymph node involvement and need their lymph nodes, all of those removed.
Right.
All of the patients who have invasive breast cancer will do a sentinel node biopsy on to determine if there has been any spread into their lymph nodes. Some of the patients that have what appears to be lymph node involvement at presentation will do needle biopsies on those lymph nodes in the office under ultrasound guidance. And if they are positive for cancer, oftentimes we'll refer them to the cancer center for chemotherapy before surgery, what we call neoadjuvant chemotherapy, to see if we can get control of that tumor, possibly shrink it down. And in some instances, the tumors disappear completely. The chemotherapy that Dr. Washington and her colleagues have to offer nowadays is considerably better than it was even a few years ago.
Oh, I know. It has come a long way in the field of medicine when it comes to, you can do target radiation or therapy or the chemotherapy has come a far way.
We can. We have the ability to deliver radiation just to that area of the breast where the cancer was after a lumpectomy now, as opposed to radiating the whole breast. And then for those patients that get that treatment, they can get all of their radiation in 5 days as opposed to 6 weeks, which is the standard therapy.
All right. Well, thank you so much, Dr. Bailey. It's good to see you again. We're going to talk to Dr. Washington now and find out some more things especially about early detection. Now we're talking to Dr. Washington, and you learned a lot of great new things whenever you went to school, that there are ways that you can do early assessments, genetic testing, to see if someone could be at risk of getting cancer. Tell us about that.
Yes, you can use tools on the internet, and you can assess actually a patient's 5-year risk, 10-year risk, and lifetime risk of developing breast cancer. And you can use those assessments to see if that person qualifies for risk reduction, which is therapy that you can give somebody to keep them from ever getting cancer.
So that's a good way of early prevention.
Yeah, it's most definitely.
Keeping it from happening at all.
To keep it from happening at all.
Because, we hear so many times about people who, it runs in the family.
That's right.
And if it does, you have a higher risk of contracting, not only breast cancer, but other types of cancer as well. But with this new thing, they may not have any symptoms or whatever, but they can get this genetic testing done and find out, and as you said, start prevention early on.
So a lot of people believe that genetic testing is just if you have breast cancer, but you can also qualify for genetic testing if you have an extensive family history of breast cancer, ovarian cancer, or just different cancers altogether. But if we focus on breast cancer specifically, not only can we assess your risk for having a genetic abnormality, but we can also assess your risk for just having breast cancer even if you don't have a genetic abnormality. Now, depending on which way we go, let's say if we are looking at somebody, we come in and they give their family history, and it's a family history that's significant enough to qualify for genetic testing, we would do genetic testing. If that person comes back positive, then there are risk reductions that we can do for that person to help them never get it based on their genetic risk.
Now, I believe that's what Angelina Jolie did. She found that she had that genetic numbers or whatever, so she went ahead and did what she felt was necessary to keep from getting it down the line.
So back then, Angelina Jolie was getting BRCA testing. I believe that she is BRCA positive. I'm not sure if she's 1 or 2. But that has a significant risk of developing breast cancer. The risk of developing breast cancer is so high in BRCA patients that we recommend prophylactic bilateral mastectomies in most of those patients. But remember, it's not just a breast cancer gene. It's also ovarian cancer. So those people may need prophylactic oophorectomies where we remove the ovaries as well. But through the years, we found out that that gene is also associated with colon cancer. It also can be associated with pancreatic cancer. We've also actually expanded on genetic testing. At first, we were just testing for the BRCA gene, but now there's a host of genes. Now we check a gene panel. So now we found out that there are several genes that can be associated with breast cancer, and depending on which gene and which risk, it'll help us develop a risk reduction plan just for that patient.
Wow. So it's probably good to just get tested early to see if you do have, one of those genes, as you talk about the BRCA gene or whatever, for breast cancer, ovarian cancer, whatever type of cancer in men and women, I would assume.
Oh, absolutely. And let's say we go down the other path. Let's say you come to see us and you say, I have an extensive family history, and that family history doesn't quite meet the criteria for genetic testing. That does not mean that you're not at risk. Wow. So then we can go to those risk assessment tools and assess your risk. And we're talking about breast cancer. We can just focus on breast cancer right now. We can assess your risk for breast cancer, and then we can develop a risk reduction plan. That can be anything from increased screening to actually using the same medications that we treat breast cancer with in terms of hormonal therapy. The pill that we use to treat breast cancer, it's also approved. They're also approved to do risk reduction. You would take it for the same amount of time. And this is for people who are at risk, but who would qualify for risk reduction.
All right, we'll cut you off, Dr. Washington. I want to tell you real quick also that during the rest of this month, they are running a special on mammographies. You can go to the website, it's on your screen, and get more information on it.